Well, you remember when the World Health Organization was created, it was 1948. Countries were reeling in the aftermath of the Second World War. The global health landscape had one set of challenges that have, of course, evolved dramatically over the years. So I'll just give you a few highlights, though, of what the World Health Organization has achieved over the years. You think about something like the eradication of smallpox, a disease that just decimated populations historically, and that was a very cruel disease. It took robust global cooperation working through the World Health Organization to eradicate smallpox. The last smallpox case in the world was in 1977. The World Health Organization has taken on increasingly different questions as they become new health burdens. So the whole question of non-communicable diseases that have become such an increasing health burden in many countries around the world. Issues like HIV/AIDS, which wasn't an issue in 1948, has become a huge priority for the World Health Organization. Something like polio, which again was just a scourge of so many countries at the time that the World Health Organization was created, has become a real source of pride and near accomplishment. We are nearing the eradication of polio now, thanks to the work of WHO partners around the world, governments, private sector, and others, community leaders who have been working so hard for so many years to try to eradicate polio. Well, the World Health Organization was set up as a technical agency. You know, there's a whole network of technical agencies that was created, again, in the wake of World War II to try to provide some of those critical, almost infrastructure types of support for countries who needed that kind of technical advice or guidance or some kind of common repository of technical work. WHO was one of those. It's obviously not immune to the politics around it. What's really interesting to me is how WHO has, over the years, at different junctures, managed to do its technical work, navigating a very fierce political environment. So I mentioned smallpox earlier. When smallpox was eradicated, that was at the heyday of the Cold War. That was not a time of robust international cooperation. It was a time of significant confrontation and global conflict and global competition. And yet, countries, including the superpowers of the day, managed to find it in their interests to work with each other and with the World Health Organization to solve that common challenge. So they're a technical agency, they work in a political environment, they have to find a way to navigate that as productively as possible. And we need to help them do it.